Good morning, folks. Welcome to the April General Membership Meeting for the Seattle-King County Coalition on Homelessness. We're really happy you're here. Hopefully you can see the screen that has our agenda on it today. Loving everybody that's been introducing themselves in the chat. Please keep doing that. Feel free to change your Zoom box name to include how you'd like us to call you, your pronouns, if you're associated with an agency, or how you are connected to the coalition. We always love to see those things. We have a really incredible program for you today. A few little just logistical things. I think someone already enacted closed captioning, but that isn't available to you on the bottom. So take a look at that. If you're struggling, reach out to myself, Tim, Rachel, Hallie, or Allison. We're your lovely coalition team. Kristen here is as well. And we can support you on that. This is going to be recorded. If you don't want to be included in the recording, just stay on mute. Throw things into the chat. We will read them out, get them in there, make sure we are able to answer it as best we can. We're pretty good about that. We love to see faces, so if you're willing to come on screen, that's always lovely. That will not include you in the recording. And if you are a member of the media, we just ask that you really only quote folks that are as part of the coalition team or presenting and what they're presenting on. And if you want to follow up with someone in particular, please reach out to myself or Allison, and we can help navigate that for you. As you can see, we've got an amazing presentation around King County crisis response, and this is both some little sort of zoomed in, kind of what's currently available, what's coming online, little review of some resources that people can have, and then understanding a little bit more about the Crisis Care Center's levy implementation plan and what's going to be available before those physical buildings actually go up, which we know is a bit away. We've got always coalition announcements and information to share with you. And then we've got time for member and community announcements. So if there is something breaking, new, a resource you want to share at your agency, yeah, please be thinking about that. We'll have that at the end. Could I have a volunteer to read our mission, vision, and values statement?
Sure.
Thank
I'll
you.
read. Mission: we mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. Vision: a region that acts on a shared sense of responsibility to ensure that everyone has a home. Values: equity, justice, collective action.
Thank you, Elizabeth. I appreciate that. Before we jump into our first presenters, I just want to highlight that Allison threw in a link so that folks can RSVP to join our community advocacy briefing that's happening on Tuesday, April 30th. It's going to be over the lunch hour and a half, 12 to 1:30. We are doing this in collaboration with ACLU of Washington and the Northwest Justice Project. And this is really to invite all of our community to have a better understanding of some really high profile cases at the national level. So Grants Pass versus Gloria Johnson. And then we're going to look at some local lawsuits and cases that are happening, including the one that we are a co-plaintiff in Burien, as well as Kitchian versus Seattle. We're going to talk a little bit and hopefully give a little bit of an understanding to folks that maybe are not as deeply embedded in this work of really what the realities of living homeless is, and the challenges that pose, and when we criminalize it, how it makes that much more harder. So we've got some advocates and providers joining us to do that. And then we're going to talk about how we can push back against these kinds of unjust and unconstitutional laws and really understand a little bit of the implications of the Supreme Court case at Grants Pass with what is how Washington State is really trying to create some protections around that. So that's an amazing thing. Please sign up for that. We would love to see you there. And then the other quick announcement is many of you are probably familiar with the Coalition's annual lawn bowling party. We are doing that again this year on Sunday, June 2nd. It's going to be from 4:30 to 6:30. We're going to have a little bit of food and beverage and drink. Typically, this is our annual fundraising party, but we're shifting it a little bit this year. It's a Sunday afternoon in the park with Coalition staff, friends, and community. And because it's our 45th year, we're really shifting it to be just a little bit more casual and a whole lot of celebrating everybody that makes the Coalition an incredibly strong and powerful advocacy body. So I'm going to throw that. Oh, thank you, Hallie, for throwing that link in there. We'll remind folks again about this and throw some of those links back in. It's really lovely to see so many wonderful faces, but I am going to hand it to my lovely colleague, Tim Marshall, to introduce our first section.
Thank you so much, Jody. So I think most of us, if not all of us in this room, understand that in King County, we've been facing a behavioral health crisis for a long time. And that's for reasons of being exacerbated during a pandemic, a dearth of resources, the surge of fentanyl. We're all aware of it. Primarily our service providers who are working with unhoused communities who are disproportionately affected by behavioral health crises. We're all working in different ways around the county to bring resources more readily available to providers and community members. And I have been lucky enough to connect with some excellent stakeholders who are working with urgency to bring those resources to us and make existing resources more readily available. We have a couple of different speakers to talk about different respective projects, but first I would like to hand it over to Brooke Bittner, who is the Director of Regional Crisis Response in North King County. She's going to talk about a dual dispatch model of crisis response operating in North King County, as well as a short-term resource that will be available in July for folks to have access to a community clinic. Brooke, thanks so much for being here.
Thank you, Tim. Good morning, everybody. I'm so happy to be here. I love Skitch, and my background as a social worker is in chronic homelessness in New York City and then in Seattle, and then through kind of policy channels, started really focusing on diversion and diverting people suffering from or are surviving chronic homelessness and suffering from chronic behavioral health conditions, diverting them from the criminal legal system. So just happy to be here with friends and colleagues. And I'm going to share some PowerPoint slides and do 3 things with my time today. The first is set some basic context about behavioral health and the crisis response system. I'm going to talk about my agency specifically that serves North King County, and then I'm going to talk about some other resources on the crisis continuum. And I'm starting with this slide that is borrowed with appreciation from my King County colleagues. That is a visualization of what the crisis response system looks like. And what we're going to be talking about today is our system's response to people in behavioral health crisis. And when I say behavioral health, I mean mental health and substance use disorder. And the behavioral health system generally is kind of coordinated, and a lot of the funding flows through King County. And where I sit is the first response system or public safety. And both of those kind of large systems are grappling with how to best meet the needs of folks in behavioral health crisis. And as we talk today, myself and the folks from King County will be talking about care along a spectrum when someone falls into behavioral health crisis, the need for someone to call, so someone to respond when you call, someone to respond into the community, somewhere safe to go, and then someone to follow up. And I'm really going to be focusing on that someone to contact, someone to call, and the someone to respond with the portion that I'm going to talk about today. I'm going to talk about my agency again in North King County, and then about the public safety system's response to behavioral health crisis. And I'm also going to just give a little bit of information, as Tim said, about the crisis clinic that's coming online in our community in July. There we go. So Regional Crisis Response Agency, I will refer to it as RACER, RCR, we call it RACER, is the product of an interlocal agreement between 5 cities in North King County: Kirkland, Bothell, Shoreline, Kenmore, and Lake Forest Park, all of whom came together to say that we want to put money into an alternative to police for people that are in behavioral health crisis. So the cities, you probably know this, but to me, even working in cities, it was better defined in my mind. Cities are responsible for public safety, generally speaking. Cities are responsible for policing, and in a lot of cases for fire as well. But the county in our region is generally responsible for homelessness and behavioral health. So there's this kind of disconnect for folks that are suffering from behavioral health conditions, living homeless, and then have contact with the first response system. So this is an attempt to say, what's the right response for people that are in acute crisis? Maybe it's not a badge and a gun. So what we do, I call it behavioral health first response, because in our community in North King County, when you call 911, there's an added tool in the tool belt for folks that are experiencing something. You have the firefighters and the EMTs if you're having a heart attack or you have a fire. You have a badge and a gun when there's a crime or a life safety issue. And now in our cities, we have a high skill mental health professional crisis responder who's able to deploy to scenes where someone is experiencing behavioral health crisis. If there's any indication of homelessness, they will usually deploy. Generally, they're also going out on calls that involve family violence, that involve kids, anything where a social worker would be helpful, although my focus today is really behavioral health crisis and folks that are living homeless, that the crisis responders in North King County are hearing the same radio that the police are and identifying the call types where a social worker would be useful and then deploying to those calls. So we talk in our community in North King County about reimagining public safety. There's been this traditional understanding that public safety equals police, and sometimes police and fire. But then this growing call as a society to say, safety is actually wellness, and the safest communities are the ones with the most resources, not the ones with the most police. And this idea that there is, again, something beyond a badge and a gun that is called for in a lot of emergency situations. Our crisis responders are going primarily to in-progress calls, a lot of calls with folks that are living homeless, that are marginally housed. We're seeing obviously a lot of the opioid crisis and fentanyl in our community. A lot of mental health crisis and a lot actually of trafficking are the big issues that we see. What the crisis responders are providing is immediate de-escalation. So that's a skill that they're very well trained and experienced in. Informal assessment. So we are all clinicians, but we're not operating as clinicians. We're assessing informally and not providing any diagnosis or treatment. And then referring to the community of care. So really focusing in on that moment of crisis and acute emergency, and then reaching out to our partners in the human services system and the behavioral health system to do the longer term. Unfortunately, as we all know, there's such a dearth of services for longer term support that often it's challenging to say what's going to keep this person from falling into acute emergency again, when there are no beds available, there are no treatment beds, there are no appointments for initiation of MOUD. So we face those struggles and are always kind of doing creative problem solving to say, what can we do at this moment that can try to ensure that someone doesn't fall into deep crisis again? I have some outcome numbers. This program has been a previous iteration started in about 2017. So when there was a social movement to reimagine policing in 2020, North King County was in a pretty good position because we had already been doing this work, already been building alternatives and building kind of goodwill among our police partners for the idea of a social worker responding to a police scene. So we have enough years of data with the previous iteration of the program, which was called Radar, that our partners at we're MID funded, were able to do some outcome data analysis for us. And I like to share this information because it's just so powerful to see that the social worker intervention for folks that had that touch in the 2 years after the touch from our program experienced a 67% reduction in adult jail bookings, a 60% reduction in crisis services events, a 4% reduction in all-cause emergency department visits, and a 14% increase in behavioral health system enrollment. So like tiering with Medicaid providers. I actually think that 14% is quite low for our community because that data does not capture folks that have private pay or private insurance. That's only Medicaid paid behavioral health services. So those numbers are really powerful to me because they say that we're doing what we want to do with this program, and that people are experiencing improved outcomes. Just a couple of stats about our 2023. 2023 was a big transformation year as we went from the RADAR program and some community response funding at the city of Kirkland to become the Regional Crisis Response Agency, and officially went live in June of last year. So our numbers reflect our program's growth over time. But over 800 folks in crisis served, 2,600 service encounters. That means that some folks are being seen more than once. In some cases, it's a single intervention that's 4 hours long, someone bringing someone down to a place where they can problem solve, de-escalation. In other cases, there are multiple touches or visits trying to really ensure that somebody's connected to the next step of care. And during 2023, we had 10 full-time crisis responders. We're now at 13 with current funding, and the need is there. I think we'll just continue to grow. So I'm back to this slide about the crisis continuum. So again, to put RACER, my agency, in context, we are someone to respond when you call 911, the someone to call. So in Washington, and actually all over the US at this point, everyone has access to 988 and 911. You can call 911 for life safety emergencies, and 988 is the behavioral health crisis line that in King County is operated by Crisis Connections and has some access to mobile resources. And then when someone responds in the field, the idea is that there be somewhere safe to go other than jail or the emergency department. So to continue on someone to respond, I'll say again that there is the behavioral health system doing mobile crisis response. That is under RFP right now for King County. DESC has done mobile crisis team for many years. I'm sure most of the folks on this call have worked with DESC's mobile crisis team. And then within the 911 public safety system, there is the concept of co-response. And again, the idea of reimagining public safety, that you have police, firefighters, and social workers all available when you call 911. There is a statewide association of programs that sit in the 911 system that provide human services. And I'm using the definition from CROA, the Co-Responder Outreach Alliance, but it's basically co-response is when there's a human services professional embedded with fire or law enforcement embedded in the 911 system. So that's what we're talking about. When Susan and Kate are talking, they're talking about the behavioral health system, 988, and mobile crisis outreach teams. And then when I'm talking about co-response, I'm talking about if you call 911, you have acute emergency, and there's a first response from a behavioral health professional. And I'm just sharing a little context that almost every first response agency in King County has some form of this program. In most cases, it's not a 24/7 response. In some cases, it is an immediate first response. In other cases, it's a secondary response. Like you may have worked with a mobile integrated health or a CARES team in the past, that those are a secondary response to the fire department. And then just a map of Washington, where this trend of having human services or behavioral health professionals within the public safety system is growing, and a lot of the major law enforcement departments and big fire districts are moving toward offering mental health, human services, social workers. And I am back to the continuum that when someone is in crisis, a community should offer them someone to call, 911 or 988, someone to respond, teams like mine or mobile crisis outreach teams, and somewhere to go, so a crisis triage facility. And there's an agency called Connections Health that is opening a crisis triage facility in Kirkland in July of this year. This is the product of about 3 years of work in our community. Our public safety chiefs and city managers up here in North King County realized some time ago that without somewhere to go, we were just going to keep going to the emergency department or to jail for people that have active crisis in the community, and advocated really hard to bring something to our community, and ended up supporting the Connections Health provider to get some capital money from the state and from the county, and they now have a relationship with the county as a funder. And if there's more to say about that, I'll leave it to Kate and Susan. But basically, when it opens in July, it will be a behavioral health urgent care plus higher levels of care plus inpatient hospitalization. But I think most relevant for this crowd is that any adult, anyone over 18 from anywhere, regardless of insurance, can walk in to this walk-in clinic and receive behavioral health care treatment. They are payer agnostic. They have really promised to work it out on the back end. So folks with Medicaid, folks with insurance, folks with no insurance, they are doing some opioid use disorder treatment. They're at this point, they're not positive whether they're going to initiate MOUD, but they're going to coordinate with other community providers. And they are providing care in other communities and have a lot of history providing high acuity behavioral health care. So they have kind of made a promise to our community that they will always be accessible to first responders to bring folks in crisis, and that they will not turn folks away because their behavioral acuity is too high. So from the perspective of public safety, it promises to be a real game changer, that someone who cannot stay in their home or their environment because they're a threat to themselves, a threat to others, just too disruptive, that there's somewhere for them to go that's therapeutic, that's not jail. The emergency department is not always the best spot, that the psychiatric emergency care is not there. And that has the promise for good follow-up care. So I won't speak too much to their model, but it's a tiered model where there's urgent care, immediate accessibility for intake, and longer-term hospitalization, and follow-up until they're engaged with outpatient care. And those are my thoughts for today. I did a lot. Do folks have questions? Or Tim, did you want me to do questions now or at the end?
I would love for you to answer a couple of dedicated questions. Thank you so much, Brooke. This is so good. I do just want to take a second and define a couple of acronyms that we have defined in the chat, but are also good to do for the recording. MOUD, we mentioned a couple of times, that is medication for opioid use disorder. That is a service that they are considering offering at Connections Health. And then MID, which is an acronym for...
That one, it used to be known as mental illness drug dependency levy, but now rebranded to be a little more loving, just mid behavioral health tax levy. So it is a 0.1% in King County that goes to behavioral health, and has a strong focus on diversion from the criminal legal system.
Thank you so much. Yeah, I would love to take a few questions. We have a few minutes to hear from Brooke specifically, and later
I see Laura
on,
and then Aiden.
Yeah, go for it. I think Laura was first.
Thank you so much, and thanks for your presentation. Just curious here, because there's been a big push to be sure that we're including peers, which are people who receive or have received behavioral health care services, you might say lived experience. But that is actually an employable role on these teams, and I just noted they really didn't include or mention the role of peers. So I'm curious, maybe they're not yet employed in the area where you're operating, but I would encourage you to possibly mention that, as if it's not a current goal, then something you're working on for the future. But they are part of the staffing model for mobile services as well as elsewhere in the system. But I really appreciate the overview. It was quite a lot in a short period of time. So thank you for your presentation.
Thank you, Laura. I am so glad you asked that, because you're right, I should talk about that. And I will say, we don't have the peer role as defined by the Department of Health on our teams, but we do have folks with lived experience. So about half, if not more, of the mental health professionals that work on my team have some background, some lived experience. with behavioral health, with homelessness in themselves or their families, with history of suicidality or survivors of suicide. So we highly, highly value lived experience. There's a lot behind the scenes with Department of Health around the role and the licensing and the peer role specifically that is complicated for what we do. But I think the idea that someone that has lived through an experience has so much value to bring in working with somebody, we very much embrace that. And then Connections Health as an agency employs a lot of folks that are peers, certified peers with the Department of Health, and they strongly value that lived experience and the peer role in the milieu. They also talk in that case about lived experience from the peer role all the way through their staffing continuum. That lived experience doesn't mean you can't be a mental health professional or an MSW or an MD. That that kind of moving away. And in our case, we're really trying to move away from that dichotomy of us versus them. Aiden?
Hi, good morning, Brooke. Thank you so much. So I was noodling around on the website for your guys' new agency. I absolutely love it. I'm so excited about the Connections Urgent Mental Health Center. My question is primarily around follow-up or follow through for folks. So for your team, is your role limited to just connecting somebody with a crisis center and that's where the handoff is made? Or are you guys following that person for any length of time as well?
Great question. In our case, we are following only until they're fully engaged with the system of care. So a drop-off at a crisis triage facility account. In some cases, a referral is not enough. It really has to be a handhold until they're actually in relationship or in appointment with somebody. But our goal is to protect our emergency response capacity. So follow-up is always a secondary priority to answering 911 calls as they come in.
Okay, perfect. I'm up in Whatcom County, and so we have a similar
I think that's who was on the picture I showed. Wasn't that?
Yeah, I believe so. Like the great
fire-based team. Yeah.
Yeah, so like there's different iterations of how, you know, folks have executed the teams, whether it's like short-term follow-up as well as like just the emergency handoff. So myself and my colleague Lizette, who's also on this call, we're community connectors for Molina Healthcare. And so we're oftentimes like a connection point for more longer term supports. So besides Connections, when they're opening up, are there other community partners that perhaps folks from my team could engage with to make sure that you know, we're offering support where and how we can to kind of braid resources and time with those centers who are trying to provide direct mental health services?
That's a big question that I
Sorry.
No, it's a great question. But is your question just kind of like, what are the service providers in our environment?
Yes and no. Like, so you guys are handing off to crisis service centers. You're going to be the ones
not yet because it doesn't exist
right.
yet.
Sorry,
this is our only choice is leave someone where they are, that they get arrested, or to the emergency department where they're generally released pretty quickly. But what the other thing we're generally doing is connecting people to what we call the community of care. So behavioral health care providers, care management, case management, for example, well, just a number of behavioral health agencies that serve folks in our community or that serve specific populations that we work with. And homeless services and basic needs, employment, kind of all the human services and mental health, everything. We're social workers, so we're thinking about what's the wrapping this vase needs to stay safe and stable and to not fall into acute crisis again. And that's a little bit of everything. Sometimes informal supports, family, friends.
No, that makes total sense. I guess my question, if I can kind of restate it, is
thank you.
Connecting with those other partners who are taking that next step. Are there connection points? Are there referrals? Are there gaps in care or services that somebody like my team who does resource and referral connections could be helpful with? Because you'll hear from those folks more directly than we will.
I think immediate accessibility to all kinds of treatment is a gap right now that all outpatient behavioral health, mental health, and substance use disorder providers are having a wait list that's not very amenable to somebody that's in acute crisis.
Yeah.
I would if I had to identify a gap, I would specifically say we need to move faster and stronger on immediate initiation of medication for opioid use disorder, MOUD. If maybe
I know that
talk offline too, if I can offer kind of more specifics about North King County.
Awesome. Thanks so much for the great questions and the wonderful conversation that you're bringing, Brooke. I do want to give folks, particularly service providers, an opportunity to ask Brooke or any of our presenters more questions at our next Q&A segment, but we are going to have to move on to the next segment, including Mitch. I see your question in the chat. Let's raise it at the next segment. Thank you for bringing it. Awesome. Thanks again so much, Brooke. We really appreciate you being here. Brooke was talking about a county-wide resource with the Connections Health Center, as well as some more specific to North King County resources. I want to broaden our scope a little bit when we hand it over to our next speakers to talk about resources that are going to be available in many spaces around King County, including, you know, I don't want to, I want to let our presenters speak for themselves. Let's pass it over to Kate Baber and Susan McLaughlin. Thank you so much for being here.
Thank you, Tim, so much. And hi, everybody. My name is Susan McLaughlin. I use she, her pronouns. I am the director of the Behavioral Health and Recovery Division at King County. And I'm joined by my colleague, Kate Baber. Kate, do you want to introduce yourself?
Hello, Kate Baber. I use she, her pronouns, and I'm serving as the Crisis Care Center's Implementation Planning Director.
And I was trying to do this while you were talking, Kate. I'm going to pull up our slide deck. So just give me a minute here. I think this is the right one. You can see Brooke's slide there too. We all use the same one. Try to figure out, is this slideshow? Yes.
I would say that's your slide, Susan, that I borrowed.
That's true. It's all right. It's a good representation. Anyway, again, thank you so much for having us today. Kate and I are really excited to be sharing with you a once in a career transformational opportunity that we have here in King County. I want to just acknowledge and note that this was a voter approved levy. It was approved by voters back in April of 2023. That will bring in about close to $1.2 billion over the next 9 years to help us establish the paramount and supporting purposes that you're going to hear about today. It's the Crisis Care Center's initiative. Once the ballot measure ordinance was approved by voters, the process was to develop an implementation plan. And then that implementation plan was transmitted from the executive's office over to King County Council, who ultimately has the authority to approve the implementation plan. That plan is in the legislative process right now, so you'll hear a little bit about that, but I just wanted to note that it hasn't formally been approved by council yet. Once it is, that will free up and authorize the spending of the money to implement what you're going to hear about today. So what Kate and I are going to talk about is how that implementation plan was developed with community input, and then really what it says and how it's proposing to invest to achieve the purposes of the ballot measure ordinance. So you saw this slide already. This is what I think an ideal continuum of crisis care should look like. We are going to focus primarily on somewhere safe to go because that is the largest gap in our community right now. As you heard Brooke mention, the options for anyone dealing with a loved one or as a first responder or outreach worker coming into contact with somebody with a mental health or substance use disorder crisis, really the only options are jail or the emergency department. And I think we all know that those are not sufficient or effective options and not safe therapeutic places for people to go. So that is what the Crisis Care Center initiative is trying to achieve. I will just also note that for King County, we have a lot of responsibility for a continuum of behavioral health services, from prevention, early intervention, outpatient, residential. The Crisis Care Center levy will get integrated into that continuum of care, will be connected and be a part of it. But just to level set people's expectations, I just want to say it's not going to solve all of the problems of the behavioral health system, but it will take us very far and advance a lot of the needs that we have in our community. Kate, I'm going to turn it over to you.
All right. Thank you, Susan. Thank you so much, members of the coalition staff, for having us. I just I had the pleasure of leading the development of the implementation plan. And I just want to express my gratitude and appreciation for all of the people who are part of the coalition, who contributed to that planning process, who provided feedback, who engaged with us over the summer and fall. I really am grateful for your time and your feedback. Certainly has I think strengthened the proposed plan that was transmitted from Executive Constantine to King County Council, and just appreciate your ongoing advocacy and work to support people living in our community. So this slide right here is a depiction of the primary purposes of the Crisis Care Centers levy. And these three purposes, they were established in the voter-approved ballot measure ordinance that passed last April 2023. And these are the three purposes that are carried forward in the proposed implementation plan. So to Susan's point, the Crisis Care Centers levy is not scaled in scope to meet all of the unmet needs in our community: behavioral health, affordable housing, homeless services. We know there is still a ton of work to do and are committed to continuing to do this work. However, this is a transformational, once in a generation scale investment to fill some huge gaps that will benefit and be available to all people living in our community, and will, I hope, be a helpful resource to homeless service providers and the people you're serving in the future. So the three purposes: the paramount purpose is developing a regional network of a new type of behavioral health facility. We'll go into more details about what will be in the facility, called a crisis care center. The levy will fund the creation, the development, and operating and service costs of 5 centers. 4 of those are going to be distributed across King County in regions called crisis response zones. One in Seattle, one in the north part of the county, the east part of the county, and the south part of the county. And then there'll be a 5th center that specializes in serving youth living under the age of 18. The first supporting purpose is restoring our behavioral health or mental health residential treatment capacity that King County has lost in recent years. We've lost about 1/3 of our residential treatment capacity since 2018, and there's capital resources to build back with this lost capacity. So residential treatment, this word residential means so many different things in different settings. So I just want to clarify, this is not housing. This is a type of licensed behavioral health treatment facility. It's a less intensive type of facility than an inpatient behavioral health facility, so like a hospital stay. And it's a more intensive place than outpatient or office-based behavioral health care. So it's kind of a mid-level intensity of services where people stay, they live for not a permanent amount of time, for a short to moderate amount of time to receive services to support their recovery. And then the second supporting purpose is to strengthen our community behavioral health workforce. As all of you know so well, it takes people to care for people. Mental health, substance use, social services, these are such critical roles and professions in our community. They are so key to supporting people, our neighbors, our community members, in having a healthy, good quality of life and meeting their basic needs. And we need to build this workforce and sustain this workforce, increase the representativeness of this workforce. And the Crisis Care Centers levy makes significant investments in both our existing community behavioral health workforce and then investments to build a new crisis workforce to help staff all of these exciting facilities. Next slide, and I'll pass it back to Susan.
Thanks, Kate. So this it represents what a crisis care center model of care will look like. And I will note that all 5 of the crisis care centers will have all of the components that I'm going to talk about today. So I want to just call your attention to the middle of this slide in the blue boxes. These are the 3 main components to each crisis care center. And this graphic is designed from the perspective of an individual who might be in crisis coming into a crisis care center. So you can see sort of the person at the top left-hand side. The first component of a crisis care center is that it has a 24/7 behavioral health urgent care walk-in clinic. So think about this is very similar to a medical urgent care clinic that you might have gone to when you were sick, or maybe thought you broke your arm and you didn't think you needed to go to the emergency room, but you needed to be seen right then and there. It's the same idea. So anybody, anywhere can walk into the 24/7 behavioral health urgent care and immediately be seen by behavioral health specialists to triage what is going on and what the needs might be. And for some people, that will be enough. They might have a medication refill that they need. They might need to do some safety planning or have some conversation or get access to resources. And then they go back home or into the community, and the crisis is stabilized. But for others, they might need more than just that initial appointment at an urgent care clinic. And for those individuals, they can be triaged to the second component of a crisis care center, which is a 23-hour observation unit. Here, an individual can spend up to 23 hours and 59 minutes in a very therapeutic environment, again, with ongoing and continued specialty services from peer support specialists, nurses, mental health clinicians, and physicians and advanced practice practitioners that are available to further assess and evaluate what is going on with the individual and what their needs might be. I'll also note that this is the drop-off point for first responders. So fire or EMS or law enforcement or our mobile crisis teams that are encountering individuals in a behavioral health crisis within the community can also bring them to a crisis care center. And there will be a separate first responder drop-off point at the 23-hour observation unit where the person will be brought in and then evaluated again with a team of professionals. Now, for some folks, they might need a very high level of care because of the acuity of their either mental health or substance use condition. And it is at this point that most people would be referred out to an inpatient setting if they need that higher level of care. And that could be either a voluntary or an involuntary inpatient psychiatric stay, and they would be referred out of the crisis care center. But for those who don't need that level of care but need longer than the 23 hours and 59 minutes, every crisis care center will also have a crisis stabilization unit. And this will consist of 16 beds where an individual can stay for up to 14 days to receive continued treatment, evaluation, stabilization, and preparing them for return to the community. And you can see at that every level of care, all of those orange lines point to what we are calling post-crisis follow-up care. And this is a really important component to the crisis care center model. This will be a team of providers, particularly providers with expertise in culturally and linguistically appropriate services that will follow up with an individual for some yet to be defined amount of time, but several weeks post the crisis event to ensure that the person is safely returned to community, gets linked up to the services that they need, and follow-up care is established and achieved. Down in the left-hand corner, you'll also see the Youth Crisis Care Center. Kate mentioned one of the 5 crisis care centers will be dedicated solely to youth under the age of 18. It will have similar components and follow a similar model to what I described with both walk-in and first responder drop-off. I will note that a youth can walk into or be brought into by a parent or loved one any of the 5 crisis care centers through the behavioral health urgent care walk-in. And then if that youth needs an additional level of care, they will be transported by the crisis care center. Transportation will be appropriately arranged to the youth crisis care center for either 23-hour observation or crisis stabilization. So there is youth access at all 5 of the centers for walk-in, but if a youth needs to stay longer or needs a higher level of care, they will be brought directly to the youth crisis care center. Okay, now, it's going to take a while to bring the crisis care centers online. The implementation plan has allowed for many different options, from building a crisis care center from the ground up, which if anyone has ever built something or done construction, can take several years, to taking over existing buildings and doing renovations and so forth. So the implementation plan, I think Kate will talk about this, but conservatively has the first crisis care center coming online by no later than 2026. But 2026 can seem very, very far away, especially if you or a loved one is in a behavioral health crisis. And so the crisis care center levy implementation plan proposes some early investments that would start in 2024 to help respond to the current crisis situation. The first one I want to talk about is an expansion of mobile crisis services for both adults and youth. So Brooke mentioned earlier that we do have mobile crisis teams in King County, operated primarily by DESC at this point. The county recently released a request for proposals to expand the number of mobile crisis teams for adults in our region, including geographically dispersing them more throughout the county so that they are able to get to a crisis faster. And so that RFP is in process. The RFP stands for Request for Proposals. It closes, I believe, next week, actually. And then the proposals will be evaluated, and there will be a selection of providers, and then we'll begin to implement and expand those mobile crisis teams. The YMCA of Greater Seattle also operates mobile crisis outreach for youth. You may have heard of the Children's Crisis Outreach Response System, or CORS, or C-CORS, and that will also be expanded. So there will be more youth mobile crisis teams available in our region as well by later this year. Another interesting thing that's happening as an early investment is the embedding of behavioral health counselors in 911 call centers. Brooke mentioned the implementation of the National 988 Crisis and Suicide Prevention line. And a lot of this is to start to figure out how to sort and divert calls that come in through 911, because that's the only thing that has existed for people in crisis, to 988 in a way that allows for the specialty behavioral health response through mobile crisis. So more of that to come. We also have some early investments in to help reduce fatal overdoses from opioids, which include expansion of access to opioid overdose reversal medications, things like Narcan or naloxone, and some capital facility building expansion, like a post-overdose recovery center for folks who were recovered from an overdose. Kate mentioned our residential treatment facility capital investments. We have also a request for applications on the streets right now for current residential treatment providers who may need capital investments to help preserve their existing beds so we don't lose any more of our capacity. And then later this year, we'll be putting out a request for proposals to build that new capacity back that Kate mentioned. And then finally, we have our behavioral health workforce investments that we've also talked about. it takes people to treat people, and we need a workforce to be able to do all of these things. Then I want to, one thing that we're going to leave you with, and this will be in the slide deck when it comes out, is this slide of current resources and lines. We know that every day many of you are coming into contact with people who are living unhoused, who have behavioral health needs, and may need to figure out what is the best streamlined way to access resources. So this has a lot of the available resources and lines to get people into care that might be helpful for you as you're encountering individuals. Kate, I will turn it over to you.
We are also leaving you with different ways to stay engaged with the initiative. So we have a website that we're updating with the latest status. We have a new listserv. If you're not subscribed, we have a newsletter that goes out about twice a month with lots of updates. And then we have an inbox for questions, comments, ideas. We just wrapped up our latest community engagement series yesterday. And once council adopts the final implementation plan, we will have a community briefing to share what's in the final plan. And then we'll be moving into implementation phase, which will be really exciting. And there will be a whole new round of ongoing community engagement. That's a commitment we made in the plan, a policy commitment and a funding commitment for the next decade in response to community feedback. And because it's something we highly value. So please refer to these links to stay up to date. Next slide, please. And then I'll leave it with just the next steps. So as we've mentioned, the proposed implementation plan, this high-level budget and policy document that guides how this initiative will be implemented. That was transmitted by the executive branch, Executive Dow Constantine at the end of December. King County Council is now deliberating that plan. We anticipate it will be amended, and it's going through the King County Council legislative process. It must be passed by the Regional Policy Committee, the Health and Human Services Committee, and then the committee as a whole. The legislative schedule is being updated right now, and we are anticipating that the final plan will be adopted by King County Council in mid-June, although that timeline is subject to King County Council and could change, and it's not quite final. So with that, I'll turn it back to coalition staff, and glad to answer any questions and hear your feedback.
And actually, Tim, right before we do that, could I just jump in and say, I wanted to just make one more comment. I don't think I represented well enough when I was describing the model, and that is that the crisis care centers will be equipped to treat people in both a mental health and a substance use disorder crisis. And so there will be withdrawal management services, access to start medications for opiate use disorder and other substance use disorder evaluation and treatment components are a part of the crisis care centers as well as mental health. So I just wanted to make that really clear. Thanks, Tim.
Yeah, thank you for that last point. I think that adds some, that gives a bit more detail, and that's really helpful to know. Thank you so much to all of our wonderful speakers, Susan, Kate, and Brooke. It's really been a pleasure building some wonderful conversation out of, great need, and seeing that folks are working hard to respond to these needs is really heartening. I do want to, we have a couple of minutes for questions. We have some great questions that I want to read aloud in the chat that I'd like to pose to any of our presenters. We have 2 questions from Mitch. The first of which is, so Mitch is crisis care, or I'm so sorry, Downtown Emergency Services Crisis Diversion Facility staff. Is there going to be a centralized dispatch center coordinating first responder and hospital drop-off to route people to empty beds? Or are all beds going to be set aside regionally, such as in the case of all Eastside clients going to Kirkland, et cetera, for each individual agency? Are there going to be specialized facilities for particular populations, excuse me, e.g. high acuity medical needs, SUD, elders, non-English speaking, where some individuals will be routed across the region? And I think that that would be in regards to community crisis response. Please correct me if I misrepresented anything. Mitch, any thoughts from our presenters?
So I can jump in here just to say that there will only be 5 crisis care centers, so they can't be that specialized, but one of the reasons why there's crisis response zones, there's a couple of reasons. One is so regionally, one is not so far away that you're having to drive all the way across King County to get to one or to drop somebody off, but also because of the needs in the communities can vary significantly. So we do have a vision that the crisis care centers will be tailored to the communities and the zones that they are in. And we do have investments in a number of different ways within the crisis care center levy to both work with communities in the zones and also to center the culturally and linguistic standards and working with specialty providers to help ensure that the services are culturally and linguistically appropriate. All of the centers. People are not do not have to go to the center that is in their zone. So they can go to any center anywhere in King County, regardless of where they live. The same would be true for first responder mobile crisis team. Drop off to a certain extent, although I can imagine that they're going to want to go to the closest, that's the closest one to them. As I already mentioned, there is some transportation funding available to move people. So for example, if the crisis stabilization beds were full in a center and a person needed that level of care, they could be transferred to another center and to be admitted into a crisis stabilization bed there if they had capacity. That kind of movement will go on as well in the centers. And then Kate, I want to see if you have anything to add, and then Brooke, jump in here because I don't think I fully answered all of the components of Mitch's question.
That was great, Susan. I think the one thing I'll add just around the dispatch, once all 5 crisis care centers are online, it'll add the capacity where we don't right now. And Mitch, thank you for your work at DESC at the Crisis Solutions Center. That's such an important amenity and service and in our community. That because there's such a scarcity of facility-based care, there's, as you know, and as many others know, that there's referral restrictions of who can refer someone to the Crisis Solutions Center. That barrier will not be in place to care because we'll have expanded capacity. So there won't be referral requirements. It's a no wrong door approach where anyone can walk into any crisis care center without an appointment, 24 hours a day, 7 days a week to receive care. And so that's going to really significantly increase the capacity in our community and the ability for people to access care. We are envisioning these 5 crisis care centers working as a network. And so we do envision, if one's at capacity, as Susan mentioned, there's transportation resources. And as we move into implementation, those will be some of the details we work out, is like, how do we communicate that within a network? How do we leverage health information technology? How do we have good protocols and workflows with various first responders? And that'll be the next phase of implementation and planning. Thank you. Thank you for your question.
Okay. Brooke, feel free to respond. Yeah. Oh, we can't hear you, but you're not muted.
We can't hear you, Brooke, no.
Let's take a second and then probably come back to Brooke. We have limited time, but I do want to raise a couple of questions that I think may be appropriate to pose to our presenters to have a conversation over email. Mitch, you asked, will the operations of designated crisis responders change significantly after the implementation of the new crisis care centers? I would imagine that could depend on the implementation plan and other factors. Any quick kind of start of a response to that one?
Yeah, I mean, I think the quick response is the work of a designated crisis responder will not change. That is in statute, and what they do and how they do it is all legislated. What we hope will change is we need to rely on them a lot less to do evaluations for involuntary commitment, because people are able to get access to the care they need much sooner. And in a voluntary therapeutic environment like a crisis care center, they can be stabilized, individuals can be stabilized and de-escalated in a way that doesn't require the involuntary commitment. So more to come on that. We don't have data to prove that, but that would be our hope and our vision for how this would work. But their day-to-day job will not change.
That is really helpful to hear. Thank you so much. I have one more question because I think that it brings to the conversation kind of the mechanics of how you access these resources. It's from Alaric. I would love to hear from you if you're comfortable unmuting, just to make sure that I'm getting the point across correctly. But basically, you didn't catch what they said about 911 and 988. Are you not just transferring behavioral health calls over now?
Can you hear me now?
Yes.
Oh, good. Technical difficulties always. I can speak a little bit to that, and it was kind of like my little extra slice from what Susan and Kate talked about with just coordinating care. They're in King County. We're not quite there yet with interoperability between 911 and 988. Valleycom, it's the 911 operator in South King County, just launched a collaboration where they will embed 988 mental health professional operators at their 911 call center, dispatch center. And the idea is that there could be an easier back and forth transfer depending on the acuity of the behavioral health crisis need. And that's exciting for those of us that want to see alternative approaches, because it means that the system is better able to sort and deploy the right resource at the right time. The future of 911, 988 interoperability is that there's kind of seamless warm transfer between the two, kind of a no wrong door where you call 911 or 988 and you always just get the right resource, but we're not there yet.
That is, yeah, that sounds like a very accurate reality to, a challenge that many of us have experienced, and appreciate knowing that we're ideally moving in the right direction. I do want to end the conversation for now. I really thank everybody for their wonderful questions and our presenters for our wonderful insights. I would like to just quickly pop my email in the chat. If anyone has questions for our presenters, feel free to email me and I can pass them on and make sure they are answered for you. And I would like to pass it over to talk about the continuation of this conversation, talking about the implementation plan quickly, and what we can do to ensure that we are acting as a community to ensure that our behavioral health crisis response needs are met. Allie.
Awesome. Thanks, Tim. And thank you so much, Brooke, Susan, and Kate. You all gave a great introduction into both the scope of the Crisis Care Center's levy and also the implementation plan itself. So the implementation plan is going through the legislative process of being approved by various bodies of elected officials. And we are really focused on making sure that that plan stays as good as it is right now as it goes through all of those processes. So, some things that are really important in the plan that are included that we really want to protect include some specific provisions that meet the needs of people experiencing homelessness. So there's specific outreach for people experiencing homelessness and specific follow-up for people experiencing homelessness after a crisis care center visit. There's some funding for temporary housing for folks to help avoid people getting discharged from a crisis care center to the street. So we're really interested in protecting those. Also, Laura, to your question about sort of local opposition, there is a really important provision in the plan right now that if after a good faith effort, if cities cannot cite a crisis care center by the end of 2026, the county has the power to cite one itself. So that's something that we are really interested in protecting so that people who need crisis care services can access crisis care services without any unnecessary delays. So I'll invite everyone to take action with us this morning. We like to always give, when we can, give an opportunity to take action at these meetings. And we've got a letter that you can send both to King County Council members and Regional Policy Committee members that highlights those really important parts of the plan and asks them to please, pass a strong plan and please don't delay. So please join us in taking action. Thanks. And I think I'm passing it to Alison next to continue some conversation about advocacy.
Yes. Thank you so much, Hallie. Thank you, Tim. I'm going to attempt to be really quick, which those of you who know me know is not always my strong suit here. Building on the fact that we have an opportunity here to make a dramatic shift in what crisis response means and looks like in our community. I will say that there is an opportunity, but not the one that we would wish for there to be a dramatic shift in how people who are experiencing unsheltered homelessness across our nation are responded to. And that is a reference to the United States Supreme Court taking up a review of a case that originated not too far from us in Grants Pass, Oregon. I think that many folks on this call have probably heard a little bit about it. I'm going to ask one of my colleagues to just drop the link, Grants Pass versus Johnson, in the chat here. The National Homelessness Law Center has created an entire website about this case. For those of you who want to read up about it, there is also a link to an article by published in the Street Roots newspaper out of Portland, Oregon, that goes into really excellent and sad depth about this case. But essentially, this is a class action lawsuit filed on behalf of people who are without homes in Grants Pass, Oregon. Deborah Blake was the original person on whose behalf the case was filed. And very sadly, Ms. Blake passed away in 2021 after 3 years of fighting in this case, which is now represented by Ms. Gloria Johnson and Mr. John Logan, who are the class representatives. And the case has gone all the way to the United States Supreme Court because of a concerted effort by extreme right-wing folks who have some pretty strange bedfellows, including California Governor Gavin Newsom, who does not, generally speaking, consider himself to be a right-wing actor. Among other things, he is a Democrat. And at any rate, there are folks who have brought the Supreme Court this case and asked them to rule on it. And it is a case that's being heard, oral arguments are being heard on Monday, April 22nd. So many of our national partners, National Low Income Housing Coalition, the National Alliance to End Homelessness, the Center on Budget and Policy Priorities, the National Homelessness Law Center, the National Healthcare for the Homeless Council, and many others are organizing a week of action. And many entities have brought legal advisors in to create amicus briefs or friend of the court briefs. We're going to be sharing additional detail about our amicus brief early next week, but I will tell you now that the Seattle King County Coalition on Homelessness worked with a very excellent attorney locally, Jim Lobsons, to develop an amicus brief, and we were very pleased to be joined in that brief by the Quaker Meeting from the Southern Oregon Grants Pass region, by the Wheel, Women's Homeless Equality and Education League, I believe I got that right, and by former King County Medical Examiner, Dr. Richard Hariff, and former King County Prosecutor, Dan Satterberg. That is one of over 40 amicus briefs that were filed. Over 1,000 organizations contributed to them. And there's an extraordinary opportunity for this to be chance that we all contribute to educate people about why these kinds of laws that fine, arrest, punish, banish, and try to exclude people who are too poor to have a place to live from various jurisdictional boundaries are not only cruel and we believe unconstitutional under state and federal constitution, but are totally counterproductive. And they really distract and detract from our ability to do things that work to assist and support and shelter and house our neighbors. So we are working with the ACLU of Washington and the Northwest Justice Project to do an educational event of our own. It is actually going to be a little later than the National Week of Action. It's going to be on April 30th from 12 to 1:30. We're calling this a community advocacy briefing, and we hope that it will be a really important educational opportunity to take a look at some of the current legal lay of the land, both Grants Pass, the ACLU's case, which is Kitchian versus Seattle, the case that we are involved in with 3 Burien residents, which is Hale versus Burien, and then also to hear from folks who are on the ground about what the reality is for folks who are living homeless, and to begin to pull together people who are interested in doing something both to resist these kinds of laws and to do things that are better. So I really hope that you will join. I think staff are putting that briefing link in the chat. Thank you, Jody. So I hope that you will join that. We'll have a lot more information about it as we go forward. And I know there are lots of questions and many people want to hear more about it. That's what the April 30th activity is designed for. But I will say at our May annual membership meeting, May 16th, we will probably also do a little bit of a deeper dive into what not to do and what to do, because we really, as a coalition, bridge those two bodies of advocacy, education, and work. So I will pass things on. Forgive me, I have to see where we're going. Coalition trainings. We've got some excellent trainings coming up, and I believe that Jody or Tim is going to quickly tell you a little bit about those while we move into the next part of our agenda.
Yeah, really briefly, I will just mention that we have some great trainings to recap and to attend. As anybody who has joined us before knows, we have all of our trainings available on our YouTube and our blog. So you can watch them at any time. We did just host a training on the Working Families Tax Credit. Tax season has passed, but you can still claim this tax credit for low income and moderate income individuals and families, citizens and non-citizens in Washington until December 31st. Please pass on this resource because we want people to get this cash in hand. We also have a training coming up for any service provider who is working with people in the process of accessing Social Security disability benefits. Those who have done this knows that the process can literally take years. So in the meantime, state benefits are helpful in getting some kind of financial resource and housing subsidy potentially to qualifying clients. So that is going to be on the 25th. You can watch the Working Families Tax Credit training recap anytime. We'd love for you to join us live on the 25th, which is next Thursday at 9 a.m. on Zoom. Yeah, thank you so much to everyone who has joined us to learn with us and share resources. I would like to turn it over at this point to our members for a couple of announcements. This is a time to, particularly for service providers or other members of the coalition, to share resources, helpful information, events, and well wishes and networking too is welcome. We do have a couple that are planned in advance, so we can make sure we can get this information out. Hallie, I know that you were going to briefly talk about continuum of care, a couple of relevant announcements to that.
Yeah, I'll be super quick and I'll put more information in the chat. The King County Regional Homelessness Authority is looking for applications for their Continuum of Care Board. You can find more information about that board and what they do on their website. And also the annual Continuum of Care convening is happening on May 29th from 10 to 3 in person at St. Mark's Episcopal Cathedral. And I'll drop a link to RSVP as well. Thanks.
Thanks so much, Hallie. I believe, Jody, you have just a little bit more information about our lawn bowling event.
Just another real quick mention that we are really excited for this community building event. We've got sliding scale tickets as part of this fundraiser that the coalition does. We're really focused on, you know, celebrating our community in our 45th year. We have a more major fundraiser, big 45th anniversary event on September 12th. So save that date, and we'll get that information into the registration page too. But really fun event. If you've been to lawn bowling before, you know, come join us. It's going to be a great afternoon in the park. So I'll drop that link again.
We can all use a day in the park. That's wonderful. I want to pass it over now to Pam from Whole Washington, who wants to talk about a single payer healthcare initiative in Washington. They're going to share a little bit of background and things that you can do as a community member or service provider to prepare for things going on in the next legislative session and the interim to get informed. Pam, you are welcome to unmute and share. Thanks so much for being here.
Okay, thank you, Tim, and everyone very much. So I'm a retired nurse at 42 years and have been thinking about universal healthcare for many years. So I am a board member of Whole Washington. I'm going to put a bunch of links in the chat here in a second. And we are working with the Universal Healthcare Commission in the legislative part of our group here and in Olympia. And we're really trying to get to the point where how do we pay for universal health care? Can we get this going? Why is it taking so long? Those type of things. So we are we're all volunteers, and a lot of us in healthcare, a lot of us not. So I'm going to leave some links about town halls that we're doing. There's several in 2 coming up in June in the Seattle area, and many more. We're going over around the entire state. And we'd love to have you come and learn more about what we're doing, how we're trying to promote this, and the people that we have involved so far. There's so much information. I think it'd be better for you guys to look at the Whole Washington website. We keep it updated on a regular basis. Thank you to some wonderful volunteers. And I'll put my email in as well if anyone has direct questions for me. But we think it's time for universal health care. If the federal government's not going to do it, then we're going to work with inside our state. And our biggest thing that we were working on was trying to get approval from both the Senate and the House to send a letter to to the president and the Congress and say we need waivers. What we're calling waivers is to get Medicare and Medicaid to allow us to have the money to come into the state to help with finances. So there's a lot of things going on, and I appreciate this moment to talk with you, and I'll go ahead and put those links in the chat. Thank you.
Wonderful. Thank you so much for sharing that, Pam, and sharing those links for how people can learn more. I want to open it now to anyone who would like to speak. Elizabeth, I see your hand, followed by Laura Harrington. Go for it.
Yes, I've already put in the chat some information related to the Grants Pass hearing on the 22nd. There will be a live stream with commentary from local legal eagles. So if you go back up in the chat a ways, you'll find the information on that and also some background information or links to get you there. Thank you. And there's a rally at 4 o'clock in front of the U.S. appeals courthouse
Wow.
in Seattle.
Nice.
Yes, thank you, Elizabeth. We will see you there. Awesome. Thank you so much. Laura, go ahead.
Hey folks, just wanted to mention I work at Seattle Public Libraries, and as you may have seen in the news, we recently announced a lot of closures at branches across the city. So just wanted to make note of that. We know that so many folks rely on our spaces and our services to for enjoyment and for safety and comfort. And so we know that this is going to have an impact on our community, you know, maybe especially those who are unhoused and don't have a lot of other options. So just wanted to mention that. I'll put in the chat a link to a post on our blog that outlines those closures. And I'll also put a link inviting folks to share feedback with our leadership because we do think it's important to, give folks a chance to explain how these closures might impact them. So I'll toss those in the chat, but if you have a chance to share with your constituents and remind them that our buildings might be more restricted, more closed than usual, that would be welcome. Thanks.
Thank you so much, Laura. That is saddening news and important news that we need to share so that people can have their expectations set. I see a hand from Stacy Valenzuela. Do you have a community announcement or provider resource, Stacy?
Well, I help in the community, and we've worked with Northwest Justice and a couple other places, but basically, you know, our senior population, those with disabilities and veterans that live at the manufactured home communities, I've been bringing forward for at least 7 years now. We need help to keep housed because we're being priced out by corporate investors that are buying the places, and within weeks, if not months, increasing the rents, inflating them drastically. And there are lawsuits pending because they inflated them themselves. And we have a chance to keep 25% of that group from adding to the homeless that they have been every few months when these increases go into effect. In the summer, there's at least 5 to 8 mobile homes in mobile home communities in my area that increases will again price out several. And they're doing this on purpose so that they can bring in people that pay higher rents, confiscate homes that they get a $50,000 to $150,000 bonus when they resell. We keep hitting walls of people that say they will help, and then there's no help. And, you know, I'm one of the luckier ones because I didn't get my disability till in the last, 7 to 10 years, whereas other people, they're in their 70s and 80s. Some are, you know, hitting 90. And their incomes are so low because at that time they only got $700, $500 a month. Sometimes families are helping, but there's not a lot of help out there because so many people need the help. And the levies that were designated as veterans and seniors are going to senior centers instead of actually seniors. They're going for programs and administration and hiring people to help instead of the seniors. So we're up against a wall on a lot of these homes. And, you know, the purchasers of these parks, the corporate investors, are buying 20 parks across Washington. This is a crisis. In my park, it'll be August that I don't know how many people will be priced out. In the park down the street, it's June. In another one up the street, it's June. So, you know, I don't know, you know, we've gone to the legislation, we've gone to the county, we've been promised a lot of help, and it's 5 months of meetings and then no financial help. So I hope you guys will include us. I know Sound Generations, Northwest Justice, they all include us to a bit, but we need attorneys to help. We need elder abuse to help. The AG is doing what they can because they help solve at least 7 cases in 2023, 1 in February of 2024. But these are multiple violations and mistreatment of our most vulnerable. So I just want to keep that in everybody's perspective of what's going on.
Thanks
Thank
for
you.
sharing. Yeah, thanks for sharing that, Stacey. Appreciate that perspective. And we've heard similar things of that when we've had some of our legislative previews and legislators bringing up some of those same issues. I am going to thank you all for being here today with us. This was a really wonderful full meeting. Really appreciate all of our presenters, everyone that shared in the chat and came off of mute. So I am going to go ahead and end this meeting now because we have a 10:30 meeting that some of us have to get to. So have a lovely, wonderful rest of your day. Thank you all. Take care. Bye-bye.
Thanks.